So, Ram Ram by Sare, today we are going to see ophthalmia neonatrum, that is neonatal conjunctivitis. Okay, neonatal. What is neonate? Tell me in the comment section. It is bilateral inflammation of the conjunctiva occurring in an infant less than 30 days old. Is also known ophthalmia neonatorum. Okay, ophthalmia neonatorum or neonatal conjunctivitis seen in a infant less than 30 years old. Okay, any discharge or watering of the eyes in the first week of life is a suspect of ophthalmia neonatorum, as tears are not formed until then. Okay, मतलब in infant doesn't have tears. Okay, if any watery discharge is seen, it is suspected of ophthalmia neonatorum. Now coming to the etiology of ophthalmia neonatorum. Okay, what is the source and mode of infection? Source of mode of infection, it is divided into three parts: before birth, during birth, after birth. Okay, before birth, that is infected amniotic fluid in the mom with ruptured membrane. Okay, that is liquor amnion. Infected amniotic fluid in before birth. Okay, during birth, that is infected birth canal. Okay, child born with face presentation or with the infected forceps. Okay, during the birth. Next, after birth, first bath of newborn, clothes, fingers soiled with infected lochia, etc. Okay, what is lochia? That lochia means after pregnancy, like it will come lochia rubra, lochia alba, that those things. Okay, it will be infected on before birth, during birth, and after birth. Okay, this is a source of mode of infection. Now coming to the what are the causative agents. Okay, causative agents, it is the onset within first 6 hours. Then it is chemical neonatal conjunctivitis that with silver nitrate and pyridine iodine. Within 1 to 2 days, that is Neisseria gonorrhea. Within 3 to 5 days, other bacteria like Staphylococcus aureus, Streptococcus hemolyticus, Streptococcus pneumoniae, Haemophilus species. Okay, 6 to 10 days is herpes simplex virus 2, that is infected birth canal of the mother. Okay, if 5 to 14 days, chlamydia trichomatis. Okay, D and K strain. Now coming to what are the signs and symptoms of ophthalmia neonatorum. Okay, in the children, eyeball is pain and tenderness. Okay, eyeball pain and tenderness. As the infant cannot tell there is pain and tenderness. Okay, these are not seen actually, but eyeball will be pain and tenderness is present. Okay, eyelid is swollen and herpes simplex virus is periocular vesicles. In herpes simplex virus, periocular vesicles are seen. Okay, eyelids are swollen. Now coming to the conjunctiva. Conjunctiva will be hyperemia. Hyperemia is there. It is redness. Chemosis. Vessels are seen. Next, mild papillary response. Absent follicular response. Because immaturity of the lymphoid system up to 6 to 8 weeks of life. Okay, as lymphoid systems are not well developed, that's why follicular response is absent. Next, discharge. Gonococcal neonatal conjunctivitis is purulent. Non-inclusion neonatal inclusion conjunctivitis is mucoid or mucopurulent. Okay. Next, corneal. On corneal, herpes simplex ophthalmia neonatorum is, we can see superficial punctate keratosis is seen. Okay, complications of gonococcal ophthalmia neonatorum are corneal ulceration, corneal proliferation, corneal opacification, and staphyloma formation. Okay, ulceration, proliferation, opacification, and staphyloma. What is the prophylaxis of neonatal conjunctivitis? Antenatal measures are surveillance of the mom during third trimester. Okay, she should not be infected with herpes simplex virus, or any hygiene should be maintained. Everything. Okay, thorough care and treatment of the genital infections. Okay, natal measures are delivery at aseptic condition. Newborn baby should be closed eye and cleans and dried. Okay. Overall hygiene should be maintained, otherwise ophthalmia neonatorum can happen. Okay, postnatal measures are pyridine iodine 2.5%, 1% tetracycline ointment, 0.5% erythromycin immediately after birth, and ceftriaxone 50 mg per kg intramuscular or intravenous single infection. Okay, Croidase method is 1% silver nitrate solution is put into the baby's eye as soon as possible after birth. Okay, Croidase method, 1% AgNO3 is put. Pyridine iodine or tetracycline erythromycin should be given immediately after birth. Okay. Treatment. Diagnosis is by conjunctival cytology sample and cultural sensitivity swab. We can take swab and send it for culture. Chemical neonatal conjunctivitis is self-limiting. Okay, and gonococcal neonatal conjunctivitis. For that we will give topical saline lavage should be done. That is every hourly, and bacitracin eye ointment 4 times a day. Atropine sulfate ointment if cornea is involved. Okay, if atropine should be given if cornea is involved. Otherwise, photophobia eyes will go. Next, systemic 7 days treatment we will give. That is ceftriaxone and cefetoxam should be given with respective doses in IV or intramuscular hourly. Next, norfloxacin 10 mg per kg per day. Next, penicillin G should be given for gonococcal infection. That is 50k units full term. Net weight of the baby if 20k premature for low birth weight. Okay. Based on dosage we will give. ceftriaxone, cefetoxime, norfloxacin, and penicillin should be given for systemic. For topical, we will give saline lavage, bacitracin eye ointment, and atropine sulfate ointment. Okay. For other bacteria, so broad spectrum antibiotics, drops and ointment should be given. Tobramycin and neomycin or bacitracin can also be given. Now coming to neonatal inclusion conjunctivitis, topical tetracycline 1% or erythromycin 0.5% eye ointment should be given 4 times a day for 3 weeks. Systemic, we will give erythromycin 50 mg per kg, 3 to 4 divided doses. Okay, in divided doses we should give for 2 to 3 weeks. Okay, and we should also treat parents also. Next, azithromycin suspension 20 mg per kg, single dose, oral we should give for 3 days. Okay. Next, for herpes simplex neonatal conjunctivitis, it is self-limiting. Antiviral topical antivirals can be given, and high dose acyclovir IV should be given. Okay, for systemic. Next, this is a picture where you can see gonococcal ophthalmic neonatrum. Okay, whitish color fluids coming from the infant. Okay, this is the clinical features incubation period based on chemical 6 hours, gonococcal 1 to 2 days, other bacterial 3 to 5 days, neonatal inclusion conjunctivitis 5 to 14 days, herpes simplex type 2 is 6 to 10 days. Okay, this is depending upon the type of causative agent. Okay, incubation period. Chalo, this was ophthalmia neonatrum. See you in the next video. Until then, Jai Hind, Jai Bharat.